My name is Maureen, and I'm a Respiratory Care Coordinator with BJC Home Care Services. Every job that I've ever had is a learning opportunity, and those learning opportunities is what makes me choose home care, because home care is the most rewarding. Home care is the type of field that you have to think a lot on your feet. Unlike working in a hospital where you go from shift to shift, when you leave that patient in home care, basically you're the one that they're going to connect with. You're that key person that they're going to rely on. I start out with checking emails, and then I look for any patients that we started working on discharge planning that haven't gone home yet. After that, I usually go up on the floors and start to check in with each of the case managers.
Did you ask her if she had ever had CPAP before, or should there anybody else following?
CPAP before.
And no other equipment. Good.
I also have a BlackBerry. I can get emails or messages from anywhere in the system. I can message back, so I can really be in touch with anybody in a matter of seconds. I work with numerous teams. I work with the team at Home Medical Equipment daily, all day long. I work with sometimes pulmonary rehab down at the hospital. I work with the home care coordinators on a daily basis.
Okay. What about orders? Do you need
on any given day, I can work with 2 teams or I can work with 5 teams. It's nice. It never gets old. It's always new.
All right, and then I'll fax everything to you. Great. Thanks. Bye.
We probably have the best technology for respiratory patients I'd say in the bi-state area. What we do with patients to get them home is very state-of-the-art, and we are very well respected because of that.
Okay, this is the type of ventilator that we're going to send your husband home on. We'll come to the house, we'll have everything set up in the house, we'll go through each setting, we'll go through all the alarms.
A respiratory patient, per se, is probably going to want to know what the equipment will be like at home. Since it's electrical, they may ask about the utility bills. A big question is portability. If they're on oxygen continuously, they're going to be taking a tank with them. So they're going to want to know how long it's going to last, what it's going to look like, will it be heavy, will it be light, an array of questions.
If he's not getting the amount of breath that he should, you're going to hear an alarm. But you'll know because everything is set. When we put the machine on up there, the physician will actually say what's supposed to be set. So if there's something that's not meeting his needs, we'll contact the physician.
So I try to allay some of their fears just by letting them know that we're going to be available to them. I give them our phone number at that time, which has all the BJC Home Care Services phone numbers, and put my name on the back. If they have a question before they leave the hospital, they can contact me. At BJC, I feel as though I have value in what I do. I feel that my supervisors rely on me and my expertise. They trust me. I know that I can take issues to them. I know that I can make suggestions.
And you're looking for an additional diagnosis that'll work?
Just about everybody that touches that patient contributes to them going from a hospital setting to home. When you get to see them go home and know that they're going to be in the environment that they choose to be in, it's a very good feeling.